Good evening, ladies and gentlemen. Thank you, Dr. Isam, for that nice brief introduction about the ENT presentation. It was a very good presentation. I will be continuing this talk with the significance of nasal health in children today. So let's start about talking about nasal health, why it is so important in today's practice. We see a lot. I'm sure pretty most all of you will be busy with the flu season going on in your respective areas of practice, where we see children coming to us, parents coming to us with a lot of issues regarding my child is not sleeping well, he has a poor school attendance, or they're falling sick quite regularly. And that's when we start counseling parents about the importance of nasal health in children. So let's start about talking about nasal congestion in children. The most common clinical syndromes that we see causing nasal congestion in children are allergic rhinitis, vasomotor rhinitis, chronic sinusitis, and upper respiratory tract infections, which can be either viral or bacterial. Nasal congestion can cause nasal obstruction, but not all nasal obstructions are caused by congestion. Nasal congestion involves the cavernous tissue in the terminates. It can also in turn lead to sequelae of conditions such as sinusitis, otitis media, or onset or worsening of mild to severe sleep disturbances, including obstructive sleep apnea. Believe me, I have seen at least 4 to 5 children in my practice in the age group of between 5 to 10 years coming up with severe obstructive sleep apnea. And it was a very tough task for us to treat him as a team along with our ENT surgeons at Prime Hospital. Nasal congestion is also a key important component of rhinitis. Rhinitis is defined as an inflammation of the lining of the nose that is characterized by nasal congestion, rhinorrhea, sneezing, accompanied by itching. So what happens with nasal congestion going on for a long time in a child? So nasal congestion can lead to impaired nasal breathing and subsequently mouth breathing. Mouth breathing can have serious health consequences in children as well as in adults, as Dr. Isam rightly said earlier. They can have adverse health consequences of mouth breathing, such as sleep disturbances, bad breath, dental decays, gum disease, teeth and jaw complications, noisy eating, speech and swallowing problems. We see a lot of children with slurred speeches, and when we come to know that they have either an adenoid hypertrophy or recurrent nasal congestion issues, that we need to treat them. Airway tissue trauma and developmental issues also. There have been a lot of studies done when based on the survey done by around 687 children aged between 6 to 12 years in Brazil. They found out that almost 1/3 of the cases are caused by nasal congestion, and up to 46% of the children have impaired nasal breathing. Nasal congestion and impaired nasal breathing can have a negative impact on the quality of life of children also, which earlier Dr. Isam had also mentioned. You see mood disorders coming up, sleep disorders coming up, affecting the cognitive functions also, like drowsiness, poor school performance. The schools are missed. There's a lot of low confidence in these children. And sometimes you even see them going into a mild form of depression. And in very late stages of these nasal congestions, we also see reduced sense of smell, taste, and hearing also. This was a study done wherein they have found out that almost 1/3 of the people with nasal congestion suffered from impaired sleep or sleep disorders. And around 46% of the patients feel that their allergy limits them from participating in social activities, social interactions. So goes for children also. We see a lot of children who don't like to mingle with other children because of these issues and their slurred speeches, or because of their low confidence levels, because of poor sleep or mouth breathing. And that's the reason we need to treat them aggressively. So let's start off with some case scenarios. This is the first case of a 6-month-old baby who came with symptoms of URTI for 10 days. Patient had been taken to multiple pediatricians and prescribed some cough medicines, antihistamines, but there was no relief in symptoms. So what do you think would be the probable diagnosis in this patient? We'll wait for the audience poll. So here, as we see that almost 24% of the poll was going towards this thing, towards URTI, 26% to bronchitis, and 49% to nasal congestion. So the audience poll definitely goes in favor of nasal congestion, and we'll be discussing this further in the next subsequent slide as to how this child responded to the treatment. Now, coming to the important topic about structures of the nasal cavity, which work to maintain health. As Dr. Isam also mentioned previously, nasal function is dependent on the normal nasal airway for air to flow in freely and a healthy mucosa, nasal mucosa for air conditioning and mucociliary clearance. There are a lot of factors which can disrupt the nose functions, like viruses, allergens, bacteria, which can disrupt the nasal structures, leading to dilation of the blood vessels, swelling of the mucous membranes, and narrowing of the nasal passages, which in turn can lead to impaired nasal functioning, such as suboptimal air conditioning, impaired or decreased mucociliary clearance, and too much or too little mucus, which can lead to nasal conditions and complications such as cold, flu, allergy, rhinitis, rhinosinusitis, otitis media. Nasal congestion can cause mouth breathing and then poor sleep, and then also gradually lead to impact of the lower airways. So the common cold and flu are the acute viral infections that cause nasal congestion and disrupt the nasal symptoms, another disruptive nasal symptoms. So as Dr. Isam had already mentioned previously, these are the differentiating factors between common cold and flu, which are also applicable for pediatric population. You see that generally common colds are viral as well as the flu is also viral. Symptoms generally are almost the same. Average duration is around 7 to 10 days. But the main important to see out here is the quality and the impact of on the quality of life. We see a lot of pediatric population suffering from congestion is the most bothersome symptom. The child becomes very irritable, he's cranky throughout the day, and the parents don't know what to do. There are sleep disturbances because of which they are cranky, irritable throughout the day, which gives a negative impact on the mood also. And in flu, we don't see so much of sleep disturbances as compared to common cold. And the management is almost the same for both common cold and flu. Symptomatic medicines, including nasal decongestions, nasal saline irrigation spray in older children, analgesics, and fluid intake with rest. So this patient was prescribed saline nasal spray along with only antihistamine to be continued. I would like to take the audience poll now for what was the reason of her recovery. Was it the cough syrup, antihistamines, or the saline nasal spray?
Doctor, we can go directly to the answer from your side. Thank you very much.
Okay. So in this case, the patient responded just to a combination of antihistamines and saline spray. And the parents were so relieved because they had been visiting multiple doctors, but it was only happening that the cough syrup was changed, but nobody was bothered to add in a nasal spray. And a saline nasal spray and an antihistamine combination worked for this baby, and the baby recovered in 5 days. So I will be coming to the importance of nasal health later in the subsequent slides. Let's go to the second case scenario. But before we go to the second case, a healthy nose has several important roles. The main function of the nose is to help us to breathe properly. And so goes for children also. They need to sleep well. At least 8 hours of sleep is required for a child, and that too a peaceful, uninterrupted sleep. So the key functions of the nasal cavity and the mucosa are to bring in warm, humidified filter air into the lungs. It's like a first line of defense against most of the infections. It gives a resonating cavity. The nose acts as a resonating cavity that gives voice its sound and provides a sense of smell. The ear, nose, and the throat are intricately connected and share the same mucosa lining. So when you see a child coming up with severe nasal congestion, you always have to look into the ear, nose, and the throat all together when you do a detailed examination. A disturbance in one can cause problem with another, and any disorder that can cause nasal congestion can affect smell, taste, and hearing. So let's go to the second slide. A 3-year-old baby with influenza test positive 4 days ago came with persistent cough and cold, not responding to medications. Patient was prescribed Tamiflu and some cough medications, but was having severe nasal congestion, which was affecting his sleep. Mood disorders were there, and he was not responding to medications. I would like to take the audience poll now for the next step of management in this child. So the audience poll suggests that the detailed history and change of medications was around 24%, further investigations 11%, and both would be 64%. And that is also my suggestion. The right answer is going to be a detailed history and the change of medications, followed with further investigations if required, to look for any superimposed infections which can come up with influenza, like a bacterial infection or a pneumonia, which can cause this child to not respond to medications. So the airborne irritants and the allergens that can trigger an immune response that leads to the inflammation of the nasal passages. This is what Dr. Isam earlier showed us, so I won't go into this slide into detail. He's already explained it to us. And the third slide, an 8-year-old girl came with symptoms of URTI with headache intermittently for 3 weeks. She was prescribed a cough syrup, antihistamine, and a nasal spray, but no relief from the symptoms after 5 days. What would be the plan of management for this child? I would like to ask the audience for this poll. So 16% said for polled for further investigations, 10 for change of medicines, 13% for considering a steroid nasal spray, and 59 for all of the above. Yes, I would definitely go for the D option, because that is something which we need to look into this girl who has been having the symptoms for more than 3 weeks. This looks to be a case of rhinosinusitis, which has to be treated with a detailed investigation, some change of medications, and yes, definitely addition of a steroid nasal spray, which will also help her to relieve her symptoms. So why I came to the discussion of this, the case 2 and case 3 together, is to show you the importance of nasal sprays in children. We definitely see Dr. Isam and all the ENT surgeons who definitely use a lot of saline sprays, steroid nasal sprays in adults. But when it comes to pediatric population, we are a little bit hesitant to use steroid nasal sprays. Partly due to parental pressure, oh, why steroids are being given to my child. But when you explain to the parents the actual need for the steroid nasal spray in the patient, they definitely agree to it. And once they are explained, there should be no looking back about it and treating the symptoms aggressively. So this is what I'm going to discuss, is that what is the common cold and flu or the viral infections that cause nasal congestion and other disruptive nasal activities. But when it comes to acute rhinosinusitis and chronic rhinosinusitis, the symptoms, the treatment almost remains the same in elder children, as Dr. Isam had mentioned earlier. I don't want to go into these details because we have already discussed this earlier. But a simple thing to treat about is that acute and chronic rhinosinusitis will be that the duration of up to 4 weeks, and chronic sinusitis more than 3 months should be the cutoff thing, after which you start labeling the patient as chronic sinusitis. Now, there are many medicated and non-medicated nasal solutions available to relieve nasal congestion. You can see a lot of xylometazoline, which generally we use after 1 year of age. Till then, we generally rely on saline nasal sprays. Intranasal steroid medications are also available, fluticasone, mometazone, and budesonide. And there are isodonic sprays. Saline washes generally are preferred by the ENTs, and we generally tend to refer pediatric population to ENTs in the scenarios where they are not responding to even a xylometazoline or even a steroid nasal spray. So my take-home message for today's talk is that nasal health, maintenance of nasal health is very important in pediatric population also. The main aim of keeping a good nasal hygiene is one, the child does not suffer from recurrent respiratory infections. Second, that the child does not act as a nasal carrier of most of the viruses and bacteria and spread it into the community. And the third important thing is that the quality